Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well on a Monday afternoon. I'm here in my practice at the end of a day and wanted to review with you a few things and tell you at the very end here a punchline about what is personalized functional medicine, what is wellness, what is the best way to approach in general healthcare and prevention overall. So I want to share with you a few of our cases today. I grabbed some charts, not all of them, not all of my cases today, but I thought that this would address some things and you'd find some interest. So a patient today I actually had on follow-up today. She had a lot of things ruled out because unfortunately she's a middle-aged woman in her 60s and she actually had a episode of palpitations, feeling in her chest pain, etc. Saw her cardiologist. On the stress test that she passed, she showed an arrhythmia, and on recovery she showed an arrhythmia called non-sustained ventricular tachycardia, or what we call VTAC. So she had a huge cardiac workup by her cardiologist, and completely normal. Everything looked great, valves, heart strength. She had an angiogram, vessels clear, etc. So in a nice way, this was ruled out. But one of the things that she has been experiencing is high stress, okay, and she's been experiencing some decreased sleep, which obviously decreased sleep, you can feel high stress. So this middle-aged woman here, or in her early 60s, essentially pretty healthy. Good news is, on a structural way, she's been ruled out anything that is from a cardiac standpoint, and that's wonderful. Albeit, she had that arrhythmia, and she also has this feeling of chest pains and palpitations, and also is not sleeping. Well, a very common scenario that we recommended, and also is evidence-based, is the percentage of people that have magnesium deficiency, and you've probably heard me speak of this before, but have magnesium deficiency, especially in people that have had high demands on them, high stress, high cardiac or metabolic function. She has had a lot of stress at work, a lot of busyness, etc. So the deficiency rates are near 70%, okay, magnesium deficiencies in people over the age of 50. The other thing is that what can magnesium deficiency do? Create poor sleep. So we put her on a type of magnesium called magnesium glycinate and malate. These are the best types that absorb the best and give you the best relaxation. But we're going to push her levels up to help mitigate any arrhythmias or chest palpitations and that. And I think that we'll find very easily is that she sleeps a little bit better, feels a little bit calmer, which magnesium can do, and also will give her those cardiac benefits. We did do a magnesium level on her, but I am very comfortable saying that this will help her, and also very comfortable saying that it will cause no harm. Worst thing, and you've heard me say this before, when you push magnesium thresholds, you can get a little bit of loose bowels, and so you have to play with ranges. I like to push levels up in the 600 to 800, even up to 1200 milligrams. If somebody starts getting a little bowel looseness or a little diarrhea, back off 100 or 200 milligrams. But it can be a wonderful attribute and a very common deficiency, magnesium, and it will help her. Now we had a follow-up patient here, another patient actually, 50 years old. She was a new patient follow-up, very concerned about her weight. And when we got her labs and her saliva test and things like that, very common scenario, and you've heard me speak of, is that she does have a history of endometriosis, which typically means somebody typically would have a history of estrogen dominance. At her age at 50, not yet in menopause, she is a little bit progesterone deficient. So we found that in her testing. We'll put her on some natural bioidentical progesterone, which will help her with weight loss. She also had hair loss and low libido, which very commonly go with low progesterone. Progesterone's hair protective, and you may hear of and think of adrenals or DHEA or testosterone being a wonderful thing for libido. But actually what I find is that balanced hormones are the best thing for libido. Progesterone is a feel-good hormone. It's a calming hormone. In lack of a better word or term, is women will be in a better mood or a better mindset, even if life is good and things are wonderful and there is a committed, loving relationship and intimacy is the goal. You can't get there if you have low progesterone. That's what's very common. So this will help her out, I think, very nicely. The other thing that was found, though, too, is that she has had and came in here with psoriasis, and she had a little bit lower in her saliva cortisol test, and that's your adrenal hormone cortisol. I'm going to switch her from a topical cortisol cream that she was using on her elbows and her knees to a vitamin D based cream. Will help externally the psoriasis very well, but also we're going to treat her inside out digestively. So we put her on digestive enzymes, probiotics, made sure that she was gluten free. All these things I know you've heard me preach and speak of before, but these are all very key things. In psoriasis, one of the nice things that's been studied and very effective and does not have the negative effects on the body, adrenal system, and systemic effects is topical steroids. So those are a last ditch, last thing we ever want to use. If we have to, we do, but there's other things we can use more naturally, like silver gels, like even zinc preparations. But in her case, which she also had low vitamin D, we're going to use topical vitamin D on her skin for her psoriasis and treat her digestive system, because that's your immunity. Get her gluten-free. Essentially, autoimmune type of diet is going to always be gluten-free, dairy-free, sometimes even nightshades we get rid of. But gluten-free, 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 gluten-free. You got to be gluten-free if you have autoimmunity, and she has psoriasis. So that will help her out very nicely, and I think she'll do very well. She's going to see me in a couple months on follow-up. Also had a new patient this morning, an executive. He's 53. And he was here joining our concierge program, which is everything that we do here, but a little bit more streamlined. He travels the world, has a very busy lifestyle, so we'll help him with that so that he can still get the best of integrative health, best of wellness and prevention, but not necessarily be time scrutinized, if you will. But he came here for us for that. Long story short is he has some very simple things that are very common, but can be very significant. So we did some blood testing on. He's very concerned about his weight. He had gained about 30, 40 pounds as he aged into his 50s. Probably a lot of it, he admitted, is his lifestyle, eating late, stress, overeating, very common things for a middle-aged man, especially with workloads that are high and high demands. The other thing I suspect in him, and we talked about, stress responses at the cortisol level cause spiking cortisol. When you have a spiking cortisol because of stress, and chronic stress lifestyle, which your body, by the way, knows no difference in stress, okay? Whether it's good stress, bad stress, psychological, emotional, physical, metabolic, nutritional, stress is stress. Your adrenal gland responds, kicks out a lot of cortisol, and from a weight standpoint, high cortisols cause higher insulin, which causes weight gain, which also then causes plummeting sugars, and you get